My name is Dr. Tanya Ferguson. I am a hip and pelvic surgeon. I'm an orthopedic surgeon focused exclusively on problems of the hip and pelvis. I did my original training at UCSF. That's where I went to medical school and to my residency training. And it was at UCSF that I really developed a love for the pelvis. It was early on as an intern, actually, when I was on the general surgery service, that I realized I loved dealing with patients that had pelvic ring injuries. This was a very complicated fracture, one that required a multidisciplinary approach to the patient. And as an intern, interested in orthopedics, but on the general surgery service, it was a place where I really found myself engaged and useful. And I developed a great interest in hip preservation surgery. You know, hip preservation surgery is I think it's just a concept whereby we try our best to preserve the patient's native hip by whatever means necessary, and with the skills to do any and all of those operations, or replacing the hip if there wasn't a hip preservation option or solution that made sense. I've been taking care of a lot of young patients, athletes, and people who present early in their life with hip problems, hip pain. For sure, if there's a preservation approach that can be taken, we're going to take it. That includes some of the bioregenerative operations for avascular necrosis of the femoral head, for example, the reorientation osteotomies for deformity. But if arthroplasty becomes the only meaningful solution, I think these patients really benefit from the early return to function. We have developed a return to sport program for some of our athletes that are pretty high-level athletes, in fact, professional athletes needing to get back onto the field, that gets them safely back into sport much earlier. It's definitely been an important part of my practice's evolution. I think my patients would tell you that they come to the office and instantly feel like they're a person in our family and not just a problem. They're not treated like an x-ray. They're not treated like patient number 5. We spend an awful lot of time treating patients as people. And I think that's a critical part of how patients experience their surgery, and probably as importantly, their outcomes after surgery.